Good afternoon. My name is Sharika Talford. I will be discussing the African American culture and spirituality related to advanced nursing practice. My name is Sharika Talford. I'm a registered nurse for over 13 years. I graduated nursing school from the University of South Carolina Upstate in Spartanburg, South Carolina. I currently reside in South Carolina, and I'm currently at the end of my first year of the nurse practitioner program at the university. Today, I will discuss the African American culture and how the culture relates to the nursing role. The second slide, we will discuss the interdisciplinary interventions, hereditary, genetic, endemic diseases, and high-risk health behaviors. The African American heritage was excluded, dismissed intentionally in the history books. We was only mentioned in the history books as slaves, not as military heroes discovering new inventions that made life easier in America. However, this neglect and denial did not stop us from knowing who and what we came from and how strong and powerful we really are. The impact that hit the African American culture would take decades to build in a positive manner. African American genetic makeup have a mixture of the history of slavery and African culture. And understanding the connection between our genetic makeup and DNA have rapidly changed our demographic changes over the decades. For an example, it was said that the reason why African Americans have more hypertension than any other race is they said that because when we was over here coming over from the boats, that our body held on to more sodium in water so we won't get dehydrated. I don't know. That may be true. It may not be true. But that's what the story says. Statistical data show that African American are diagnosed with hypertension early in life, and nearly 42% of males and 45% of women are diagnosed around the age of 20 years old. Changing the system on research data focused on African American genetic profile and testing new drugs for hypertension and overcoming the healthcare disparities within the African American communities will improve the healthy outcome of each individual person and also providing educational prevention methods. We'll go on to the third slide where I'll be discussing the influence of value system, culture on childbearing and bereavement practice on the African American culture. Preparation in childbearing research has little focus on the African American women compared to Caucasian women. The African American culture, childbearing is a very special time in their lives. They focus on being strong and having a positive outlook on their pregnancy and also their baby. And they also recognize and understand the role of each family members. Far as like you pick godchildren, you have godparents, godmothers, and stuff like that. In other races or whatever, they don't have a godparent. They don't complain, say anything about a godmother or anything like that. But in the African American community, we believe in having a godmother and godfather, so that person, if anything may happen to you, that they will take on that motherly role as your child, and then as your child grows, that they will be involved in different aspects and special events in their lives. Effective education at childbearing ages helps with processing positive decision-making skills. Now let's go on to discuss the bereavement practice in the African American culture. Have a strong continuing bond with the deceased. We also have a sense of greater grief for the loss of extended family members and immediate family members. Also, in the African American culture, we tend to not seek professional help after a sudden death or suicide or car accident, gunshot victims, compared to other ethnic groups. All right, we will move on to slide number 4. The sources of African American culture. We will be discussing the spirituality and associated with the healthcare within our culture. African American spirituality have played a prominent role in shaping the identity of African Americans in many aspects of our lives. Our spirituality and culture practice comes from the roots of the African continent. We are born spiritual beings and rely and is an integrated part of our identity. The African culture plays an important role with the healthcare system and the lack of faith we have for our healthcare providers within the healthcare system. For an example, if you individuals remember the Tuskegee experiment where hundreds of African American men had syphilis, and the government did not give them their penicillin injections. They did a research where they held the medication because they wanted to see the stages of each disease process within the syphilis, and hundreds of African American men suffered and died from that disease, and they could have got a penicillin shot. So us having faith and trust in the healthcare system, we don't have it. And that's why a lot of men and women don't get treatment like they supposed to. John Motti stated, "I am because we are, and because we are, therefore I am." This quote stems from the responsibilities and duties we have to influence and educate our children on our African culture and allow their experience to guide their footsteps throughout their journeys in life. It creates a sense of respect, dignity, and awareness and pride. I will move on to slide number 6, where I'll be discussing the healthcare practice. Acute care versus preventive care, barriers to healthcare, meaning of pain in the sick role, and traditional folk medicine practice. African Americans have low use of preventive care due to healthcare access, lack of healthcare access, lack of physical exams, discrimination of the psychosocial mental health issues such as anger, stress, and depression. Most African American men and women, statistical data have showed that they suffer from depression and anxiety, but however, do not get the proper help due to the stigmatism related to the African American culture, as like you're being weak-minded, you're not strong if you have these issues. Barriers to health care for the African American culture practice related to social demographic, which relates to poor access to health care, not knowing the importance of preventive care services, and not knowing that it is preventive services out there and that your insurance will cover that at 100% cost. And educating the public, having health fairs and those such things to educate the public about preventive care and why is it so important. Lately you have been seeing in like the media and stuff where a lot of celebrities, as far as like Steve Harvey, have been a real advocate about getting your prostate exam and stuff like that. So that's a good example. Let's discuss on about traditional folk medicine practice have been the cure to most common disease process within the African American culture. For example, hypertension. I remember patients coming in the office saying that they drank vinegar before they came in, and I'm like, why did you drink vinegar? He was like, because it lowers your blood pressure. And behold, no, sometimes it will not, but I don't know the mechanism of vinegar and why would it lower your high blood pressure. But a lot of African American patient comes in and said that they drunk a teaspoon of vinegar before they came into their doctor's appointment. And also a cough syrup. If a patient have a cough or congestion, drinking Rocky Rye or putting onions in their sock are some traditional folk practice and part of the African American culture, and will always be a part of our culture because that's who we are as an individual. Last but not least, I will be discussing the learning styles, the autonomy, the preparation of education, the content of our culture. The learning styles in the African American culture reflects family value system, physical activities, and loyalties in interpersonal relationship. It provides opportunities for collaborative relationships, positive aspect on different projects, learning life skills. Autonomy reflects on how individual person governs themselves on a day-to-day basis. basis. Having an effective educational experience within the African American culture starts at home, which is a basic foundation of knowing who you are and what you believe in and how you conduct yourself on a day-to-day basis. For example, with my children, I always tell them if they go outside of the home to conduct yourself, if I was right there standing at you, don't disrespect yourself as an individual, and don't disrespect your family also. And I think those small little things help your children understand who they are and what they represent. Effective education starts at home, and it will validate successful educational experience. Thank you.